The process of in vitro fertilization can be emotional, it can be scary, and at times it can be uncomfortable. But a new procedure can remove the wince in at least one test. That's because instead of using needles, Boston IVF is using a saliva-based test for use in a treatment. This morning, Dr. Michael Alper says it's effective in measuring hormone levels in women. Thanks for being here.
Pleasure.
First of all, why is this such a big deal? You think, oh, it's a needle, this is part of the process. Why was it important to the medical community and to Boston IVF in particular that you remove the pain from this?
It's really important. Women going through in vitro fertilization are often like pincushions. When you add up all the injections that they get over a 10, 12-day period and superimpose on top of that blood work, it ends up to be pretty stressful. So anything that we can do to remove some of the stress in the process is beneficial and makes the process more patient-friendly.
Now, when a woman is going through the in vitro fertilization process, she has to constantly inject herself with hormones, but that's not the only injection process.
Right. So first of all, there's usually more than one hormone, so there's more than one injection. So you have to add up all the different injections, which comes out to be a lot. And then superimpose upon that blood test. And nobody likes to get a blood test done. You go to to your physician and get an annual blood test. Well, we can handle that, but try doing that 6, 7 times in a 10-day period.
It's interesting to me that this is becoming part of the medical community's process, because we've also done stories on the Fox 25 Morning News about transdermal injections, where you're not actually feeling a pinch, it's just going through your skin.
Exactly. And we actually use some of those techniques. For example, certain hormones are absorbed through the skin. Estrogen is one of them. So we often use an estrogen patch and avoid pills or even injections. So anything that we can do to make it more acceptable to patients is going to increase utilization and prevent patients from dropping out of treatment. At Boston IVF, we're really focused on keeping people in treatment because, let's face it, if people don't come back and see us because they're stressed out, we can't help them.
And of course, that's a really, it's funny because when you think about wanting to have a baby, of course, that's so much more important. But when you're going through this process, it really is, it's all of those little things that sort of add up to the stress, doesn't it?
To show you the magnitude of the stress, Dr. Domar, who works with us at Boston IVF, did a study and showed that the stress associated with infertility is about the same level of stress as somebody being diagnosed with cancer.
Wow.
It's very intense. So we're very cognizant of that at Boston IVF. Any little thing that we can do to help people get through the process is we welcome.
What's the other applications for a saliva-based test? You and I were just talking off the air. I definitely see implications for diabetics who constantly have to puncture their finger or different parts of their body. Is that possible down the road?
We don't know. We looked at a few different hormones, 3 or 4 different hormones that are related to reproduction, but we're also thinking about other applications. For example, cortisol, which is not a reproductive hormone, it's related to stress and so on, is measurable in saliva. So we'll look into this. I mean, this is the beginning, and as far as we know, we're the only IVF center in the world that's really using this approach, and I think hopefully it will be available to others shortly.
I was going to say, not for long. You actually want to share this technology with other treatment centers.
Exactly. Our initial focus was to develop the research and do the studies and do it properly. So we have a lot of data to support what we say, and then in the next few months we'll be working with a company to commercialize it so that others can make themselves available of it as well.
Interesting stuff. Dr. Michael Alper, thanks for sharing with us this morning.
Thank you.
The news at 9 starts right now.